My name is Prabhakaran Dorairaj. I'm a cardiologist and an epidemiologist. I trained in Bangalore and then at the All India Institute of Medical Sciences, Delhi, and McMaster University in Canada. I'm currently a distinguished professor of public health at the Public Health Foundation of India and the executive director of the Center for Chronic Disease Control at New Delhi. So our partnership with Emory Global Diabetes Research Center started somewhere around 2007. This was way back in 2007, November, I think. There was a call by United Health. It was called Ovations, an Ovations program for establishing centers of excellence in cardiometabolic disease research across the world. Professor Venkat Narayan from Emory reached out to us and said this is a great opportunity and we should apply for this grant. We applied for the grant and we won the grant, but at that particular point of time, NHLBI from NIH also wanted to fund some programs, and we again applied to the NHLBI program and we got funded, and that's how the collaboration began. In that particular grant or particular program, we had three projects. The first project was to establish a good surveillance model for cardiovascular disease in urban locations in India. And when we thought about it, we needed to do two cross-sectional surveys, one initially and then 5 years later, to see what's the change that has happened in the community, as well as look at surveillance models for India. But as we moved along that path, we realized that we have a tremendous amount of pressure in terms of data from the initial baseline survey that we conducted, and we decided why not convert this into a cohort, follow them up biannually in terms of obtaining blood samples and in terms of obtaining detailed data, and annually to look at hospitalization as well as deaths and other illnesses that they may acquire. So it became a fine cohort, and we were also successful in having almost 80% follow-up in the first instance. Secondly, what happened was the second cross-sectional survey that we did in 2016 was also added to the original cohort so that it became a dynamic cohort. And now we have close to 19,000 people in our database, 21,000 people actually, 2,000 of them died. So, but the survivors are around 19,000, and that's the CARRS cohort now for us. I would say that we reflect what is an ancient Indian philosophy. In Sanskrit, it says Vasudhaiva Kutumbakam, which means the whole world is a family. And we really embody that philosophy. That's number one. And second is all our researchers are humble enough to accept the fact that what we know is equivalent to the fistful of sand, as one of the ancient Tamil philosophers said. But what we do not know is almost equal to the vast ocean. And we always strive and explore to understand a little more of whatever that we have to learn.